Hi everyone, my name is Professor Caroline Homer and I'm one of the co-chairs of the Pregnancy and Perinatal Panel for the Task Force. We're really excited to be working with the wider task force on issues related to pregnancy, labour and birth, newborn care and care of women in the postpartum period. It's a very moving time, as I'm sure you know. There is more evidence coming out about COVID-19 and pregnancy than we can keep up with. We meet every week. We are looking at the evidence every day. We are synthesizing the evidence and pulling it together and coming up with recommendations that go through to the leadership group of the task force and then to the steering committee and then to you. And all of that happens in about 6 days. It's a living guideline model, and that means that we don't wait until 3 years or 2 years or 6 months or whatever the time frame is to update the guidelines. So they're constantly being updated. So have a look at the URL, put it on your desktop somewhere or in your phone so you can quickly find it. Don't expect to remember all the recommendations. They keep being updated as we go along. So far, the Pregnancy and Perinatal Panel has put out 3 recommendations, and we think these are really important. That's why we started with them. And the first one is mode of birth. And clearly for women with COVID infection or suspected COVID infection, they're really worried about how they're going to give birth. And you as clinicians are really worried about what's the safest thing for the woman, what's the best thing for the woman, and what's the safest thing for you as the providers. And we're really concerned, obviously, about all of those issues. So when we've looked at the evidence, and there's one systematic review that has the highest level evidence, and as you know, there's not a lot of evidence, but we're using everything that comes out. So one systematic review from the first author is Walker, and this systematic review we have synthesized, and the recommendation is for pregnant women with COVID-19, mode of birth should remain as usual care. So whatever you would normally recommend to the woman, whatever your clinical judgment is, don't let COVID or suspected COVID change that. You're going to go with usual care in your usual guidelines. Our second one is breastfeeding, and I'm sure you've seen stuff in the media around concerns around breastfeeding. We're using the same systematic review, the Walker review for breastfeeding, and our recommendation is that breastfeeding is supported irrespective of the presence of COVID-19. However, women with COVID-19 who are breastfeeding should use infection control and preventive measures themselves while infectious. So that means really careful hygiene, hand hygiene, instructing women to wash their hands before and after they handle their baby, and wearing a mask while they're breastfeeding or holding their baby. So the normal stuff that we're recommending for everybody in terms of hand hygiene, and then the mask as an additional protection. And of course, this is only while women are infectious. This is not for their entire postpartum period. It's only for those early days when they're infectious in hospital, and then again when they go home. So the third specific recommendation to our panel is about rooming in. And again, this is one that's created a lot of challenges out there in clinical land. I know that from talking to clinicians and reading the media and social media. We're all concerned about whether this is a safe thing for mother and baby. But again, using that same evidence from Walker, our recommendation is for women with COVID-19 who have given birth. We support rooming in of the mother and the newborn. Women with COVID-19 should use infection control and prevention measures while infectious. The same measures that I just recommended for breastfeeding. The harder one in this one is the issue around physical distancing. And clearly when you have a brand new baby, the thought of being physically distant from the brand new baby is a tough thing. So we are recommending that women do practice physical distancing when not feeding or caring for their baby. And we know when you talk to women about that as clinicians, that's going to be a hard discussion. But it is important to remember those basic principles that we're talking about with everybody across the country and across the world actually around COVID. So to be reassured as clinicians that those 3 areas really don't change, except for the addition of the mask and hand washing for breastfeeding and rooming in. So hopefully that will reassure you in your care of pregnant and postpartum women. We've got two other areas that we've provided recommendations, including with adult non-pregnant people, and that's in the drugs, so dexamethasone as one drug and remdesivir as the other drug, and you'll find those recommendations on the website under the drugs specifically. I'm not going to go through those recommendations here because they're changing so often as more evidence is being published. Thanks everybody. Let's hope that was helpful, and keep looking at the website and seeing as new updates come along.